Hi, my name is Katie Chenard, and tonight is my audience. I have my mom and my stepdad, John, tonight. So today I will be talking to you guys about the benefits of horse therapy and and how it can impact and benefit the lives of children with mental and physical disabilities. I first want you guys to think about these situations for a second. Imagine a child with severe anger issues, or a child in a wheelchair and who can't move most of their lower extremities, or a child with severe anxiety and they can't go out into the world and play with other children, for instance. What do they all have in common? They all suffer from some sort of disability, whether it be physical, mental, emotional, or social, that's preventing them from living their life to the fullest, really. Something that can help with this is equine-assisted therapy, and according to the article Equine-Assisted Therapy that was published in 2016, this type of therapy is utilized to help improve a child or a person's physical, emotional, occupational, or social growth. It just helps them improve their daily life. So today I would like to discuss with you guys the types of horse therapy and how they can improve the lives of children, the different types of disabilities that this therapy treats, and what certification is needed from the horse and the therapists involved. So the two types of therapy are hippotherapy and therapeutic riding. And according to the authors Coca and Ada Stephen, who published their article What is Hippotherapy in 2016, hippotherapy is a physical, occupational, and speech therapy that utilizes the natural gait of a horse and natural gait and movement of a horse to provide motor and sensory input to the person involved. And from this, the person or child can learn how to get proper balance, proper posture, strengthen their muscles in their back and their abdomen, and can increase their motor and sensory skills. There's also a type of horse therapy, which I mentioned before, therapeutic riding. This is more to focus on the mental disabilities of the child, but it can really be used for anything. Activities in this really involve brushing the horse, riding the horse, leading the horse around a designated area, really anything. And sometimes, depending on the child or the situation or the therapist, really, the child won't even touch the horse. It really just depends on the situation and how the child reacts to the horse in their environment. So equine-assisted therapy treats many disorders in children with disadvantages, whether it be physical or mental. And the article Equine-Assisted Therapy, which was published in 2016, states that it benefits children with attention deficit disorder, autism, depression, anxiety, dementia, developmental delays, traumatic brain injuries, behavioral issues, abuse issues, and many other mental and physical problems. So now I'm going to play for you guys a video that really emphasizes my point about how this can benefit the lives of both the children and the parents involved.
Alright, okay, girl.
And this guy is named Hunter, and he suffers from cerebral palsy.
You like horses? Yes, we love it, huh? We look forward to it each week. Yep. Yeah. Hunter is a fun kid. Horses is his passion, and so when we got into this program when he was 4 years old, it has been his life. He looks forward to it every week, and he just has like a special bond with horses, and especially Midnight, the horse that he rides.
Good job, Hunter.
Good job, Hunter.
Alright, so you can see just the life and this program really brings him. Cerebral palsy, he can't really move, so in his daily life, so this kind of helps him and gives him that freedom that he might not have in his daily life. So I would finally like to talk about how the horse and the therapist involved have to have that certification to be involved in this program. The horses have to be physically fit enough and be calm enough to be involved with these children, so they have to go through a specific program to actually take part in this, and they have to test their physical stamina, their cardiovascular health, and endurance, and they have to have the strength and the calmness, and they have to be ready for children with that are going to be unbalanced and just not, they have to be ready for unfamiliar situations, because these children just don't know, just that you don't know how these children are going to react. So also the therapists have to be certified. It's a 3-step program through the PATH International organization, so the Professional Association of Therapeutic Horsemanship International. So it's a 3-step program. They have to do certain things like get their CPR and first aid certification and send that in. It takes a while, but after they do it, they're certified, and they usually have to have a bachelor's and a master's degree in animal science or counseling. So, and they also have to be very good with children and in calm in stressful situations. I just want to make a final point that these types of programs, these therapy programs, are really beneficial for children like this, and they're just more and more being created and being used because they just benefit the lives of these children so much. And yeah, that's all I have. So thank you.